The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks. Hey everybody, this is Jonathan Marks and welcome back to Go to Health. We're always so glad you're here. We've produced now over 100 episodes, and as you know by now, we always focus on evidence-based medicine because we're looking for the truth in healthcare. And I have to speak today about some tough truths in healthcare. The title of our show today is, Are We Witnessing the Dumbing Down of U.S. Healthcare? There's been so much going on in terms of cutbacks in the Trump administration and with DOGE. I really just wanted to provide an overview for what's happening so that if you're just seeing this in bits and pieces, I can help you put this together into a bigger picture. So I want to talk about 4 topics today. The first is the measles outbreak and the response by the U.S. Centers for Disease Control, which has changed drastically from what it used to be. The second topic I want to discuss is how foreign aid cuts are setting the stage for disease outbreaks throughout the world and in the U.S. Our third topic is how food safety is jeopardized by cuts in federal funding and staffing. And the final topic is a listing of the federal agencies that have been gutted and cut in the federal healthcare cutbacks and how that rolls down to the state levels and also to our health. So I know this is some tough news. You've probably heard it in bits and pieces, and what I'm trying to do is put it together for you here in a bigger picture so you understand what the ramifications of all these changes are. So stick with me, we'll get through this together, and I've got some recommendations at the end. So our first topic is the measles outbreak in the U.S. Centers for Disease Control. It's 2025. And we are witnessing a resurgence of measles in the United States, something that never should be happening in a developed nation, and really hasn't happened here since 2000, when we had basically eradicated measles from the United States. The CDC, once a powerhouse in disease prevention, has been stripped of its funding and authority, leaving it powerless in the face of preventable outbreaks. With vaccine misinformation running rampant, and public health initiatives gutted, we are seeing childhood diseases that were once nearly eradicated making a comeback. The CDC has been forced to reduce staffing, limit outreach programs, and cut back on monitoring efforts, all while the federal government downplays the crisis. What happens when our public health system can no longer protect us? We're about to find out. The CDC recently aborted a plan to roll out the news about the measles outbreak, something it would have done normally under previous circumstances. The CDC would have emphasized the importance of vaccinating people against the highly contagious and potentially deadly disease that is spread now to 19 states, according to records. Robert Kennedy, our new HHS director, said in a recent statement, quote, "The decision to vaccinate is a personal one. People should consult with their healthcare provider to understand their options to get a vaccine and should be informed about the potential risks and benefits associated with vaccines." Jennifer Nuzzo, who's the director of the Pandemic Center at Brown University School of Public Health, said the shift in messaging is alarming. And I quote, "I'm stunned by that language," she said. "No vaccine is without risk, but that makes it sound like it's a very active coin toss of a decision. We've already had more cases of measles in 2025 than we had in 2024, and it's spread to multiple states. It's not a coin toss at this point." For years, the CDC has never minced words on vaccines. It promoted them with confidence. One campaign was called Get My Flu Shot. The agency's website told doctors that they play a critical role in helping parents choose vaccines for their children. Quote, "Instead of saying, 'What do you want to do about shots?' say, 'Your child needs these 3 shots today.'" So it was very clear about the necessity and the importance of getting vaccinated. Now, the CDC's risk assessment about measles was carried out by its Center for Forecasting and Outbreak Analytics, which relied in part on new disease data from the outbreak in Texas. The CDC created the center to address a major shortcoming that became obvious during the COVID-19 pandemic. It functions like a national weather service for infectious diseases, harnessing data and expertise to predict the course of outbreaks, just the way a meteorologist warns about storms. Other risk assessments by the center have been posted by the CDC, even when their conclusions might be obvious. But this obvious statement by the CDC about the measles outbreak has been squelched. In late February, for example, forecasters analyzed the spread of H5N1 bird flu. The risk to the general U.S. population, they said, was low. This needs to be followed and tracked because viruses mutate and change and spread. We've seen bird flu first in chickens, then cows, then milk, now cats drinking raw, non-pasteurized infected milk. In the case of measles, scientists at the center determined the risk of the disease for the general public in the U.S. is low, but they found the risk to be high in communities with low vaccination rates or communities that are near outbreaks or who share close social ties to those areas with outbreaks. There was an internal plan to roll out news of the forecast by the expert physician who's leading the CDC's response to measles. He was going to be the CDC's chief spokesperson in answering questions. The statement was going to read, and I quote, "It is important to note that at local levels, vaccine coverage rates may vary considerably, and pockets of unvaccinated people can exist even in areas with high vaccination coverage overall. The best way to protect against measles is to get the measles, mumps, and rubella MMR vaccine," unquote. Recently, even though confirmed measles cases have risen to about 500, agency staff were told in an email that after a discussion in the CDC director's office, quote unquote, "leadership does not want to pursue putting this on the website," unquote. This cancellation was not normal at all. When rollout plans are this close to implementation, a cancellation has never occurred. The agency's cost-cutting program, proposed and implemented by DOGE, asked the Public Health Agency to sever roughly 35% of its spending and was told to do so by April 18th. The cuts promised to further hamstring this agency, already reeling from the loss of 2,400 employees, nearly one-fifth of its workforce. Tom Inglesby, director of the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health, said, quote, "Sure, any manager can find small savings and improvements, but these kinds of demands are the size and speed that break down organizations. This is not the way to do good for the public or for the public's health," unquote. Last week, HHS abruptly discontinued CDC grants of about $11.4 billion to the states that were using funds to track infectious diseases and to support mental health services, addiction treatment, and other urgent health issues. So with all these cutbacks just in HHS staffing, the cancellation of significant grants, and the dissemination of disproven information about vaccines by our new health leaders, we can certainly say that we are dumbing down the quality of health information coming from our federal agencies. So that's example one. Next, I want to talk about how foreign aid cuts are setting the stage for disease outbreaks. This is another thing I'm sure you've heard about in the news. The United States has historically played a critical role in global health. Foreign aid has helped control the spread of diseases before they reached our shores. But that safety net has been slashed. Billions in foreign aid for disease prevention and vaccination programs have been eliminated, and the ripple effect is already being felt. Countries that relied on U.S. support to combat tuberculosis, malaria, and HIV are now struggling to contain outbreaks. And as we know, in an interconnected world, diseases do not stay within borders. The result? Increasingly dangerous pathogens will find their way back to us, and we won't be prepared to handle them. A successful outbreak response requires coordination of many, many elements. Let me list them for you. Investigators to confirm the initial report, workers trained to do the testing, access to test kits, transport of samples, a lab with enough workers, running water, electricity, and chemical supplies for diagnoses, and experts to interpret and act on the results. The big picture is that the CDC used to provide expertise on diseases, USAID funded logistics, and the World Health Organization convened stakeholders, including ministries of health. Before the aid freeze, employees from each organization often talked every day, sharing information about debating strategy, and together they lowered response times to many outbreaks, to just 48 hours most recently. But now CDC experts who have honed their expertise over decades are not even allowed to speak to colleagues at the World Health Organization. Quite a tragedy. Outbreaks that begin overseas can travel quickly. The coronavirus may have first appeared in China, for example, but it soon appeared everywhere, including the United States. When polio or dengue appears in this country, cases are usually linked to international travel. In interviews with many members who are current and former officials of the United States Agency for International Development, members of health organizations, and experts in infectious diseases, they describe a world made more perilous than it was just a few weeks ago. The timing is very important. The Democratic Republic of Congo is experiencing the deadliest monkeypox or mpox outbreak in history, with cases exploding in a dozen other African countries. The United States is home to worsening bird flu. Multiple hemorrhagic fever viruses are smoldering: Ebola in Uganda, Marburg in Tanzania, and Lassa in Nigeria and Sierra Leone. We're not just turning our backs on global health. We're setting ourselves up for a devastating public health emergency at home. So we've talked about the cutbacks of the CDC and the misinformation on measles, and we've talked about the cutbacks in international aid that can bring diseases and viruses to our shores with little more than a plane ride. My next topic is food safety in the U.S. and how that's being jeopardized, but I want to take a brief break and come back to you with that. So stay with us. We'll be right back. You are listening to Go to Health Media. To reach Jonathan Marks or his guest expert, you may send an email to jonathanmarks@gotohealthmedia.com. You may also visit and subscribe to the website and show at gotohealthmedia.com. And now, back to this week's show. Hey, this is Jonathan Marks. Welcome back to Go to Health Media. Remember, you can subscribe to us at gotohealthmedia.com so that you never miss an episode, and I encourage you to do so. Thanks for your support. The next topic I want to talk about is food safety being jeopardized by an onslaught of funding and staff cuts. It's not just our healthcare system that's being stripped down, it's the very safety of our food supply. Budget cuts to the FDA and the U.S. Department of Agriculture have forced massive layoffs, reducing the number of inspectors monitoring food production. What does that mean for you? More contaminated food hitting the shelves, more recalls, and more foodborne illnesses that could have been prevented. Recent reports show high increases in cases of Salmonella, E. coli, and Listeria outbreaks. Without proper inspections and oversight, companies will cut corners and consumers will pay the price. The most vulnerable, children, the elderly, and those with weakened immune systems are at the highest risk. It's fantasy to think that food corporations will self-regulate. Has that ever worked for us in public safety? In the last few years, foodborne pathogens have had devastating consequences. Bacteria in infant formula sickened babies. Deli meat ridden with listeria killed 10 people and led to 60 hospitalizations in 19 states. Lead-laden applesauce pouches poisoned young children. In each outbreak, state and federal officials tracked each sick person to a tainted product and ensured the recalled food was pulled from the shelves. The states are particularly critical to tracking diseases, assuring vaccinations, implementing product recalls, and educating the public. The severe cutbacks in federal funding is flowing down directly to the states. The state employees in their specific roles in ending outbreaks are being eliminated due to cutbacks in federal funding to the states, and the states cannot afford to fund this themselves without raising taxes. The myth of government efficiency will now result in higher rates of illness and disease, which in the end will cost more money to solve, with the U.S. population paying the price financially and health-wise. Like the food safety system itself, the cutbacks and new administrative hurdles are spread across an array of federal and state agencies. At the Food and Drug Administration, for example, freezes on government spending have stopped staff members from buying food to perform routine tests for deadly bacteria. In states, a $34 million cut by the FDA has reduced the number of employees who ensure that tainted products are tested in labs and taken off store shelves. At the Agriculture Department, a committee studying deadly bacteria was recently disbanded, even as it was developing advice on how to better target pathogens that can shut down kidneys. Committee members were also devising an education plan for new parents on bacteria that can live in powdered infant formula. A Trump administration email to the committee members read, quote, "Further work on your report and recommendations will be prohibited," unquote. In 2024, nearly 500 people were hospitalized and 19 died from foodborne illnesses with a known cause, double or more than the year before. Often in response to a deadly outbreak, a joint FDA and Agricultural Department committee dived into the details to seek ways to improve detection and to limit illness and death. The Trump administration abruptly shut down the committee in March, citing the executive order on reducing government bureaucracy. It demanded that work stop for the panel called the National Advisory Committee on Microbiological Criteria for Foods, and also for the National Advisory Committee on Meat and Poultry Inspection. One thing these committees did was shut down an Abbott Nutrition infant formula plant in Michigan. The committee planned to then provide advice to caregivers who should use sterile liquid formula instead of powdered formula, which is not sterile. And for icing on the cake, so you know, the new FDA Food Division chief is a former corporate lawyer, and he worked on cases defending Abbott over claims of harm related to infant formula. A little bit of a conflict of interest. Michael Hansen, a scientist and member of the committee from Consumer Reports, said the decision to end the committee was a shock and destroyed almost 2 years of work on harnessing genomic sequencing. The team leveraged hours of volunteer work from the top experts in the field. Very efficient. So we've covered cuts to the CDC in managing and communicating about measles, the devastating effects of cutbacks in U.S. aid for preventing diseases abroad, and now the cutbacks in food safety research and staffing. I want to cover one more topic before we end today, and then I will give you some recommendations, some hope for the future. I want to list briefly all the agencies that have been unfunded and employees that millions of Americans rely on for optimal health and safety. These cuts go far beyond the CDC and food safety. Here are programs that have been cut: HIV prevention, asthma and air quality, environmental hazard response, gun violence prevention, worker safety, reproductive health, birth defects, disability health, tuberculosis prevention, blood disorder programs, the National Survey on Drug Use and Mental Health, lead poisoning prevention, water safety, and the Tobacco Control Division. There's no question that health institutions can be run more efficiently. Reimagining public health is essential, but tearing it down with no plan to rebuild is not transformation, it's sabotage. The ultimate justification for these cuts is cost savings, but these cuts do not make any financial sense. Federal workers make up less than 1% of the HHS budget, and public health programs are all about prevention, which is not only good for our health, but can be much cheaper than treating the disease. Our administration is simply dumbing down healthcare in the United States. Rural hospitals are shutting down at an alarming rate, leaving entire communities without emergency care. Mental health services have been gutted, forcing thousands to go without necessary treatment. Even medical research has taken a hit, as we've just shown. The NIH is receiving fewer funds, slowing progress on life-saving treatments and new drug developments. We're not just losing healthcare access, we're losing the future of medicine. These cuts aren't just numbers on a spreadsheet. They will cost lives, and yet we are being told this is simply budget efficiency. So some closing thoughts. Where do we go from here? The reality is serious. U.S. healthcare is under attack. The institutions designed to protect us have been defunded and dismantled, and the effects are unfolding before our eyes. We must ask ourselves, will we stand by while our public health system crumbles? Will we allow profit-driven policies to dictate the quality of our healthcare system? Or will we demand accountability and fight for the healthcare system we deserve? Why is this happening? The results of these cuts and changes will threaten disease rates and the quality of healthcare in the United States. Why would anyone do that? To save money? That makes no sense. Having a diseased population is much more expensive than having an alert system and a research system and a prevention system that keeps people healthy. This dumbing down agenda weakens the United States and our standing in the world. Whatever the reason, it's time for each of us to do our part in advocating for the smart healthcare we've enjoyed. It's not perfect, it can always be improved, but let's not dismantle things that are working. What do you think? Have you or someone you know experienced the impact of these healthcare cutbacks firsthand? Share your story on social media. If this episode resonates with you, please subscribe and leave a review. So what can you do? I've got 3 possibilities for you. Let your state and federal representatives know how you feel about these cutbacks. Write a letter. Attend a town hall. Many brave Americans are participating in protests. Number 2, support and join organizations that are fighting for the kinds of healthcare you want to see. And number 3, vote. It's so important to be heard at the ballot box. Don't stay home. You've got to get out and make your voice heard. I want to thank you for listening today. I know the topic of this is not uplifting, but these are realities that are happening today, and I think it's best that we face realities and work with them. I want to thank you so much for listening. Until next time, stay informed, demand better, and fight for the healthcare system we all deserve. Remember, subscribe to us at gotohealthmedia.com so you don't miss an episode that we have coming up. And as we always say at the end of every show, go to health. Take care. We'll see you again next time. God bless.